In August 2016, we have met 32 members of the Parliament of Mongolia and 5 ministers of the cabinet to make sure that the hepatitis prevention, control and elimination program is included in the 2016 to 2020 action plan of the government of Mongolia. We have just shown you some of the photos of these meetings. The HPCE program was already included into the election platform of the Mongolian People's Party with an explicit mention of the Mission 2020 to eliminate HCV by 2020 and to significantly reduce liver cirrhosis and liver cancer mortality in Mongolia. Thanks to this bold inclusion of the HPCE program into the election platform, the Mongolian People's Party was able to capture a supermajority in the Parliament of Mongolia in the parliamentary election in June 2016. That turned MPP from an opposition party to governing party. In July of 2016, the new cabinet of ministers were appointed, forming the new government, and the cabinet was preparing to submit the 2016 to 2020 action plan of the government of Mongolia for parliamentary approval. Unfortunately, when the cabinet of ministers submitted the action plan on August 17, 2016, an explicit mention of the Mission 2020 of the HPCE program was stripped out, watering down the ambitious agenda. We immediately met with Dr. Tsogtzik, a newly appointed Minister of Health. Unfortunately, she wanted to scale back the Mission 2020. We hit a major roadblock, a truly disappointing start with the new cabinet and new minister.
What do we do in the face of this adversity? We push forward and mobilise to include the Mission 2020 explicitly into the 2016-2020 action plan of the Government of Mongolia, as we'd been doing since the public launch of the HPCE program in Mongolia on September the 8th, 2014. Our core team, along with hundreds of patients, called and texted Parliament members demanding the explicit inclusion of the Mission 2020 into the action plan. We organised press conferences and gave interviews to a large number of media outlets, pushing the agenda publicly. At the same time, MP Zandashata, MP Inkbaya and MP Ink Amalan and other members of the Ilik Buton Mongol Parliamentary Caucus voiced their full support and explicit inclusion of the Mission 2020 into the action plan during parliamentary debates. Thanks to this steadfast and passionate mobilisation, we succeeded. It is symbolic that on the second-year anniversary of the public launch of the HPCE program, the Parliament of Mongolia officially approved the HPCE program into the 2016-2020 action plan of the Government of Mongolia. The Mission 2020 of the HPCE program to eliminate hepatitis C in Mongolia by 2020 and to significantly reduce liver cirrhosis and liver cancer mortalities was explicitly stated in the action plan of the Government of Mongolia. At the same time, the Parliament of Mongolia officially allocated $11 million into the 2016 expenditure budget of the Public Health Insurance Fund for subsidising hepatitis medicines during the 2016 budget addendum process, confirming the full commitment of the Government of Mongolia. On September 16, 2016, Vice Minister of Health Bimba Surin met with Dr. Jeffrey Glenn, Professor of Medicine at Stanford Medical School and founder of Eiger Biopharmaceuticals, as well as Dr. Eduardo Martins, Senior Vice President of Eiger Biopharmaceuticals, along with senior executives of the Onrom Foundation and the Mongol Society of Hepatology. They had extensive discussions about the hepatitis D endemic in Mongolia and its deadly burden. At the conclusion of the meeting, the Ministry of Health and Eiger Biopharmaceuticals agreed to cooperate in developing novel treatments against hepatitis D. The Onrom Foundation team have been working with multiple pharmaceutical companies methodically to increase access and affordability of life-saving hepatitis medicines. Thanks to the extensive discussions, negotiations and cooperation with Strides Sassoon, a generic manufacturer, and Monos Group, the largest Mongolian pharmaceutical distribution company, the cost of generic Sonofosbuvir Libasvir was lowered to $150 per 4-week supply, setting a ceiling for generic HCV medicines on October 7, 2016. The Omnom Foundation, in cooperation with Monos Group, initiated the campaign to eliminate HCV among Mongolian healthcare workers, starting from the first central state hospital. For their invaluable contributions and efforts for pushing the HPCE program forward, Honorary Member of the Patient and Civil Society Council was awarded to the 12 MPs and 3 ministers. On November the 11th, 2016, the Minister of Labour and Social Welfare established the working group to provide a recommendation on public health insurance subsidies for hepatitis diagnostics and medicines. In this critically important working group, Dr. Naranjagol Dashdot, Mr. Ink Tubishin Dort Otov, and Dr. Naranbata Dashdot were the only members representing interest of professionals and civil society. In contrast, there were 12 members representing the Government of Mongolia. The first meeting of the working group was held on November 14, 2016. To start the negotiation, the Omnom Foundation, along with the Patient and Civil Society Council, suggested a subsidy of approximately $115 for both branded and generic HCV medicines. The government refused to accept the suggestion. After a tough negotiation, the two sides finally reached a consensus, a proposed subsidy of approximately $85 per 4-week supply of HCV medicines to be proposed to the National Council for Social Welfare for its approval. This was the first tangible step toward HCV medicines subsidy. In cooperation with Professor Jeffrey Glenn of Stanford Medical School, our team of scientists determined the prevalence of hepatitis D in Mongolia, for the first time utilizing a novel quantitative microarray capture assay. This landmark study revealed that 60% of HPSAG positive Mongols are HDV RNA positive. To the best of our knowledge, this extremely high prevalence of hepatitis D is the highest reported prevalence in a country anywhere in the world. A manuscript describing these findings was accepted for publication in Hepatology, a leading international journal in the field. On the 15th of December 2016, the National Council for Social Welfare approved the consensus subsidy of $85 for a 4-week supply of hepatitis C medicines. This is the largest amount of subsidy ever approved for a medicine in the history of the Public Health Insurance Fund of Mongolia. It was also decided to backdate HCV medicines subsidy to September 9, 2016, enabling 6,425 patients to be reimbursed. It was a accumulation of earnest efforts by the Omnom Foundation, the Mongolian Society of Hepatology, the Patient and the Civil Society Council, and the Government of Mongolia. A team of scientists and physicians from the Omnom Foundation and the Liver Center published the results of a prevalence study that revealed endemic prevalence of hepatitis B, C, and D. This landmark study provided the scientific basis for the HPCE program in Mongolia and helped to formulate evidence-based policy making. On March 3rd to 9th, 2017, the second joint trip to the United States within the HPCE program was organized, with stops in San Francisco, Chicago, and Washington, D.C. MP Zander Shatar, State Secretary of the Ministry of Health, Ochibat, and Dr. Naranbata Dashdot, co-founder and chairman of the Omnom Foundation, participated. In Washington, D.C., the Mongolian delegation had wide-ranging discussions with senior officials from the U.S. Department of Health and Human Services, as well as the U.S. National Institutes of Health. In addition, the Mongolian delegation met with senior executives of Gilead Sciences, Eiger Biopharmaceuticals, Microsoft, Allied Talis, and AbbVie. They held discussions on cooperation with these industry leaders within the HPCE program in Mongolia. Finally, these discussions were critically important to building international partnerships for the HPCE program in Mongolia and played an important role for the success of the program. In accordance with the recommendation of the Joint Working Committee, the National Council for Social Welfare made a decision on March 21, 2017 that the Public Health Insurance Fund would cover the cost of 2 HCV viral load tests. With this decision, access to treatment was significantly increased, making a milestone within the HPCE program. On April 3, 2017, Professor Jeffrey Glenn met with MP Hulun Bata, Chairman of the Standing Committee on Budget Issues, and had a discussion about broader cooperation on novel treatments for hepatitis D and liver cancer. The Honourable J. Erdenbut, Prime Minister of Mongolia, met with Professor Jeffrey Glenn and colleagues to discuss cooperation on novel treatments against viral hepatitis and primary liver cancer. Prime Minister Edenbart confirmed the full commitment of the Government of Mongolia to the cooperation and expressed his utmost support for realising the full potential of the HPCE program. Following the very concrete mandate from the Parliament of Mongolia, the Cabinet of Ministers approved the detailed plan for the HPCE program on April 12, 2017, utilising a blueprint that was developed by the Onrum Foundation. In doing so, the Government of Mongolia allocated over $95 million for the HPCE program through 2020. This is the largest amount of funding ever allocated for a national program, confirming the full commitment of the Government of Mongolia. To celebrate the approval of the detailed plan of the HPCE program by the Government of Mongolia, an allocation of the largest amount of funding ever allocated for a national program, all private stakeholders, led by the Onrum Foundation, teamed up to organise Elimination Mongol Chulgang, an event forum to review all aspects and implementation of the HPCE program. On May 5, 2017, the Government of Mongolia organised the nationwide public launch of the HPCE program. Prime Minister Edenbart opened the main event in the capital Ulaanbaatar. The general population hepatitis screening was launched to identify hepatitis infection status of every individual 15 years of age or older by the end of 2018, and to register their status in the National Viral Hepatitis Database. This event marked the beginning of a new era in the implementation of the HPCE program in Mongolia.